Okay, class, we are going to start the Principles of Treatment PowerPoint lecture. This is going to go over what to do initially after an injury, after we've done the injury evaluation that we went over a few weeks ago, and how to treat it and the different modalities that we can use in the athletic training facility. So treatment depends on a few different things. The main thing is going to be the stage of the injury. So what stage that athlete or their injury is in. So I know we've talked about acute and chronic, but now we have a subdivision that's called subacute. That's kind of in between the two. So acute means a sudden injury that just happened in one instance, and they're in the acute phase of healing. If they're in about the first 3 days to maybe up to the first 5 or 6 days, the subacute phase will be about 3 to 5 to up to 20 days, and chronic injury means that we are dealing with something that's been going on for a few weeks. So usually it's about 2 weeks up to 2 years, 3 years, however long it takes to heal that injury. You guys do not need to know the box on the right for the exam. That is just showing you what's going on in each different stage of tissue healing and tissue injury. Okay, so treatment is also going to depend on tissue involved. So we treat everything differently. We're not going to do the same thing for a broken bone as we are for a strained muscle, an injured tendon or ligament. So we treat all of that different. And then also depends on the goals of the patient. So if the patient is not going to finish out their season, if they don't want to play their sport anymore, we have a little bit more time. Whereas if the patient wants to get back as soon as possible, then we can help speed up recovery in a safe way to where they can get back to where they want to be in the quickest way possible. Okay, so our general objectives for treatment are going to be these two right here. So 1, decreasing inflammation, and then 2, improving function. So that's going to be increasing strength, increasing range of motion, and flexibility. So when we talk about increasing range of motion, that usually refers to a joint, sometimes a muscle. So let's say someone sprained their ankle, they're going to have a lack of range of motion. So they will not be able to fully dorsiflex, plantar flex, invert, or evert that ankle. So that's what we're going to work on, as well as strength. And then flexibility is going to refer to a muscle and how to strengthen it while also gaining better range of motion through stretching. Okay, so this is where we start to talk about some modalities that we have in our clinic that can help facilitate quicker treatment. This is definitely not something that we do just to help relieve pain or just to start treatment, but these are treatment options that we can use with our rehabilitation therapy. So we have ice bags, hot packs. On the bottom left, you'll see electrical stimulation. And then on the bottom right, that is an ultrasound machine, a non-imaging thermal ultrasound. Okay, we can also give, with the prescription of a doctor, something called NSAIDs, which are anti-inflammatory agents. So what NSAID stands for is non-steroidal anti-inflammatory drugs. So there's some very common and really commonly used examples of NSAIDs, and that would be things like aspirin or ibuprofen. And it's non-steroidal, meaning it's not a typical steroid that the doctor would prescribe, which is a heavier anti-inflammatory. Okay, so when we talk about heat therapy, so if you guys remember before, I talked about in another lecture, heat therapy is called thermotherapy. So why do we use heat for an injury, and what can it do? So heat is going to do all of the things on the left of this slide. So it's going to increase temperature. That one's pretty obvious. With the temperature increase, it's going to increase the other three. So increase metabolism, increase circulation, and increase pain tolerance. It increases pain tolerance by just helping things relax and making things feel better. So the therapeutic outcome from all of those things on the left are going to be that it increases extensibility of collagen fibers. So what that basically means is it helps loosen up and give collagen fibers the ability to stretch. So we can use this on a joint, on a muscle, on tendons and ligaments, and that helps us gain our range of motion back. It's going to also increase relaxation because it feels good for the patient. It can decrease joint stiffness, and it can break up something called the pain spasm cycle. So the pain spasm cycle is when you have an injury that's going to cause pain. Now, immediately after an injury, your muscles and some other soft tissue structures start to tighten up around the injury to protect it. So that's the spasm portion. And then in return, because those muscles are spasming, you in turn get more pain in that area. So this is just a vicious cycle that keeps going around unless you can help interrupt that cycle. So heat helps with that. All right, now cold therapy, also known as cryotherapy, is going to do all the things on the left. So we are decreasing temperature, decreasing metabolism, decreasing circulation, so all of the opposites of the previous slide, except pain tolerance still increases. The reason that pain tolerance increases with both, we talked about heat already, but cryotherapy with cold, it's going to help numb the area. So it's also going to increase pain tolerance. The person will have a perception of less pain because it is temporarily numb. So our therapeutic outcomes are going to be that cold decreases inflammation. It will also break that pain spasm cycle because it increases that pain tolerance and that comfort for the patient. And then it can also allow for pain-free range of motion. So we can do cryotherapy, which is combining cold with movement, and that's going to help with our range of motion of the patient. All right, and then I do want to talk a little bit about nerves and nervous conduction velocity because it has to do with how we can help break the pain spasm cycle and also how we can decrease overall pain by using cold therapy, so cryotherapy. So nervous conduction velocity is referring to the speed at which a nerve fiber is going to carry that impulse from the injured area back to the brain so your brain can read it and interpret it. So a cold application using ice or other types of cryotherapy are going to slow down the speed at which that nerve fiber can carry that information back to the brain, so the nerve fibers are firing less frequently. So these arrows underneath, the top solid green arrow is going to look like a regular nerve impulse where there's constantly information being thrown from the injured area, the pain area, back to the brain. The second one and then into the third arrow there is showing examples of how it's going to slow down those nerve fiber conductions and then eventually have more frequent stops in between. So it's just interrupting that pain being perceived back to your brain. So the pain carrying nerve fibers are going to slow down, which means that your pain perception is reduced. So that is how numbing works. It's going to interrupt those the nervous conduction velocity of those nerves. All right, so general rules for cold application. You guys may have heard this before, it's very common. We use the acronym RICE. Sometimes we throw some extra acronyms on top, like a P for price or prices with an S on the end. We're going to keep it simple for this lecture. It stands for rest, ice, compression, and elevation. So these are the basics after any injury. You never, never, never want to put heat right after an injury. Doesn't matter if it's bone, muscle, nerves, tendons, ligaments, skin, you always, always, always want to start with ice. So resting it, you're going to prevent any further injury. Icing it will decrease the pain and minimize swelling and inflammation immediately, which is the most important step. Compression is going to help decrease the amount of fluid that's going to accumulate around that joint or muscle. And then elevate it, that's going to help reduce local blood pressure, which reduces the circulation to that area. It's not going to cut off all circulation, it's just going to prevent too much blood flow going to the injury. Okay, so for an acute injury, so an injury that just happened, you want to use only cold therapy, so only cryotherapy for the first 48 to 72 hours. You don't want to do hot, cold, alternating. You don't want to use heat in the beginning. You don't want to take a hot bath. You want to only use cold for the first 2 to 3 days. Then if it's a chronic injury, so something like tendonitis that you've been dealing with for several months, you can use some heat before activity, and then you always want to use cold after activity to help calm down any inflammation that may have arisen during the activity. Okay, so sensations experienced. So heat, You're going to obviously feel the warmth and relaxation when you put any sort of heat therapy on your body, but cold goes through these specific 4 stages and in this order. So you're going to have to know this for your exam coming up. So when you first apply cold, the first sensation is going to be burning, and then you'll feel stinging, aching, and then eventually numbness. So it doesn't just go numb right away. It goes in this order of burning, stinging, aching, and numbness. So the duration of the effects means how long that this therapy can last. So heat only lasts in the body up to about maybe 20-25 minutes. That means if you put a hot pack or you're in a warm whirlpool, your body tissue temperature will not stay elevated for more than about 20 minutes. But when you use cryotherapy, your body tissue temperature can stay decreased for up to about 2 hours. That's another reason why we love ice, and the main reason why we do not want to ice for 30 minutes on, 30 minutes off. You can actually cause a lot more damage than good by icing too much because you haven't allowed your body tissue temperature to raise back up to its normal number. All right, cryotherapy, these are just some examples now of different types of cryotherapy we have in athletic training clinics. We will use an ice pack with some flexi wrap or compression wrap around it to help with the compression and then also help with the greater effect of the cold feeling. We have ice massage, which is basically just ice or a frozen water bottle we can massage over different areas. We have a cold whirlpool, so this is what most people call an ice bath, but we put ice and water into a whirlpool, turn on the switch, and it's going to move the water around so that it stays cold. And you want to do this for usually about only 10 to 12 minutes, and the temperature cannot be below about 54 to 52 degrees. It should be within 52 to 60 degrees Fahrenheit. Any lower is doing a lot more damage. Ice immersion is going to be just a smaller version of that, so usually in a small bucket. We have instant cold packs. I'm not a fan of these. We don't use this in the medical world very often, and that's because they can leak or they can burn the skin because they get too cold and they're not going to melt or warm up quick enough before they do damage. Gel packs, they are less risky, but they don't retain cold that long, and it's better just to use normal ice. And then we have vapocoolant sprays. So this is just an instant relief spray. It's just going to spray on chemicals that make it feel like ice, make it feel cold, but really it's just tricking the nerves on your skin. And then for thermotherapy, for heat therapy, the most common thing that we use is probably the moist heat pack. So we take the heat packs out of a machine that has hot water in it, then we're going to wrap it in a towel and place it on the injury, but we're only going to do this if the injury is chronic or if someone just has a tight muscle, nothing that's been hurt, injured, broken, or strained recently. The downside of this is it can burn the skin if it leaks, but we use these every day and it's very, very, very rare that that happens. We also have a warm whirlpool, which is just warm water instead of cold. This is a very good source for relaxation and help breaking that muscle spasm. And the temperature of this should be about 102 to 105 or 6 degrees Fahrenheit. Ultrasound is a machine that we have. It's another modality. It uses sound waves to move and heat up tissue, which can help with inflammation, decrease pain and stiffness, and then it's also going to increase the blood flow to the area because it provides heat, and that can help with tissue healing. Again, we don't want to use this right away. Usually we will use this after the first 3 or 4 days. Then we have something called analgesics. So this is going to give the false sense of heating, just like the cold spray gave false sense of cold. Things like Tiger Balm and Flexol just make your skin think that it's feeling heat. And then we have paraffin bath. That's just a smaller version of heat therapy with wax. And that's it.